Cardiovascular conditions are the leading cause of death globally and contribute to more than 1/4 of the deaths in the US. The reason why cardiovascular conditions are so deadly is not because they're not treatable, but it's by the time we actually implement these treatment methods, it's when the condition is displaying symptoms, by which point the condition has already reached life-threatening levels. Furthermore, these methods are expensive, invasive, or time-consuming, making them impractical to be implemented during a wellness care visit. Current research shows potential in observing the continuous blood pressure waveform and observing trends such as the rate of rise of pressure during the systolic cycle, rate of fall of pressure during the diastolic cycle, and observing the magnitude and time of arrival of the reflected blood pressure waveform, as this continuous blood pressure waveform highlights that interaction between the heart pumping out blood and the movement of the blood throughout the arteries. Therefore, the engineering criteria for this research was that the device used to obtain a continuous blood pressure waveform at the patient's brachial artery must be non-invasive, low-cost, and time-efficient. And the integrated app used to analyze this continuous blood pressure waveform must support a very high resolution and communication signal, must be user-friendly, and must be universally accessible so that it can be implemented in virtually any environment, including not only the wellness care visit, but in the home setting, remote locations, and developing countries. Different sensors were explored in order to obtain the continuous blood pressure waveform, such as optical, ultrasonic, and piezoelectric sensors. The piezoelectric sensor was most promising due to its ease of use and excellent sensitivity. But even then, the amplitude of the signal from the piezoelectric sensor was too small, and it did not have a high enough resolution in order to identify key parameters within that waveform. Therefore, through a series of optimal filtration, amplification, and uniform pressurization, the signal was processed through these 4 key circuits. The signal amplification circuit amplified the signal with a gain factor of 15. The low-pass filter circuit filtered out any high-frequency noise, especially to ensure that any medical equipment found in a wellness care setting would not affect the signal. And then the voltage biasing and voltage dividing circuit ensured that both the positive and negative values of the waveform would be obtained. The signal was then processed through the PCB and was sent to the app via Bluetooth. It was important that the data was being communicated to the app at more than 200 samples per second in order to obtain a very high-resolution, repeatable blood pressure waveform. This communication rate was too high for the Bluetooth module to handle. So to overcome this obstacle, 11 consecutive samples were stringed together and were sent to the app every 55 milliseconds. This ensured the real-time high-resolution signal while ensuring that the phone would not freeze. The doctor can now turn on the device and app. Prior to this, the doctor would have obtained the patient's systolic and diastolic blood pressure values. She would have then placed the piezoelectric sensor on the patient's brachial artery and would have wrapped the blood pressure cuff around the piezoelectric sensor and would have minimally pressurized the cuff. As you can see here, this is the real-time DPDT or change in blood pressure waveform being graphed. The doctor looks for a repeatable DPDT waveform and then inputs the patient's systolic and diastolic blood pressure values. So for this patient, the systolic value was 134, and the diastolic value was 69. Again, ensuring for the repeatable signal, the doctor then begins the saving of the data. The saving of the data takes about 30 seconds as 30 cycles are being averaged. This data is still being graphed real time. The graphs displayed from the app following the 30 cycles is first the normalized DPDT waveform, which is when all those 30 cycles are taken and are averaged. This DPDT waveform is then integrated in order to create the arterial blood pressure waveform using this model as shown above. Finally, due to the research that supports the importance of looking at the time of arrival and magnitude of the reflected blood pressure waveform, the reflected blood pressure waveform was then obtained by first estimating the forward blood pressure waveform with an exponential decay function, and then subtracting that forward blood pressure waveform from the overall blood pressure waveform to get the reflected blood pressure waveform. As you can see on the app, here are the different graphs. The key feature of this app is the table as shown here, where medically established parameters were identified within the waveform, and the mean, standard deviation, and variability were outputted for these various parameters. This feature has far-reaching implications. As we can see in the PDF report here, a doctor can record a patient's baseline values year 1 for these medically established parameters. Then on a year-to-year basis, as the patient comes, the doctor is able to see that patient's current year values for these cardiovascular parameters, and then also be able to observe trends to see how these values are progressing. For instance, the doctor might see that the time to the systolic peak is decreasing, or the maximum slope during the systolic upstroke is increasing, and both those factors indicate increasing levels of arterial stiffness or increased load on the heart. And by doing this holistic approach of looking at all these multi-parametric parameters, we have a very clear understanding of that patient's current cardiovascular state, and the doctor right there and then can direct that patient to the care he needs. This device and app was tested on 3 patients, where the procedure was run at least 3 times each on each patient, and 30 cycles were averaged in order to ensure repeatability for each of the patient's data sets. This device fully meets the intended engineering criteria, with the electronic device not only meeting the gold standards of being non-invasive and obtaining a continuous blood pressure waveform, but the device is low cost, with the device costing $14.16, and also the device is very time efficient, with the entire process taking less than 10 minutes. The app displays a very high-resolution wireless blood pressure waveform and is universally accessible, which means that this device can be used in any setting, including the home environment, wellness care visits, or even in remote locations in developing countries. This device is unparalleled to any method out there for early detection of cardiovascular conditions, and it is necessary that we implement this device immediately in order to ensure that cardiovascular conditions are no longer the leading cause of death globally. Thank you.